Welcome to this explainer. I want every member of hospital leadership here today to seriously think about something. What if the absolute biggest threat to patient safety isn't some incredibly rare, undiagnosable disease? What if it's not a lack of highly trained specialists or a shortage of expensive, cutting-edge tech? Look, speaking to you right now as a busy and honestly highly frustrated physician, I can tell you that the greatest daily threat to our patients is much simpler, and honestly, it's much more preventable. It's literally just not having the right information at the right time.
So in today's explainer, we're tackling a massive, critical issue: the hidden hazards of paper medical records. I really need to convey the urgency of this reality to you all today. You know those paper folders stacked high on our desks and absolutely overflowing in the archives? They're not just some harmless, old-school way of doing things. They are an active, daily threat. A threat to our clinical efficiency, our hospital finances, and most importantly, human lives. We're going to look really closely at the workflow failures that our medical staff has to battle every single day.
Let's start with part 1, the daily clinical chaos. I want to drop you right into the frantic reality of a busy clinic. Imagine we have a patient who urgently needs a contrast CT scan. We are ready to move, time is ticking, but there's a roadblock. Their latest kidney function lab report is missing. I absolutely cannot safely order that scan without knowing their kidney data, so treatment is delayed. And why does this happen? Because patient information is dangerously scattered across entirely different physical locations. The outpatient department charts, they're down in the clinic. The inpatient records are up on the ward. Lab results are sitting in separate folders somewhere. And pharmacy notes are down in the dispensary. When a physician tries to make a rapid clinical decision, the critical info either hasn't arrived, it's waiting in another department, or it's just misplaced. We are constantly forced to retake patient histories completely from scratch, which wastes precious time and severely risks missing vital details.
And here is the most terrifying bottleneck of all. It's so simple. Only one person can hold a physical paper chart at a time. Think about the physical limitations we're dealing with here. As the physician, I need the chart to diagnose, but the nurse needs it right then to administer care. The quality team needs it for their audits, and the pharmacist needs it to verify meds. But multiple clinicians absolutely cannot access this vital information simultaneously because it's trapped in a physical silo. If a chart is borrowed, sitting on someone's desk, or heaven forbid lost, that information just effectively disappears for everyone else.
Which brings us to part 2, medication errors and handwriting. Safe healthcare depends entirely on having the right information at the exact right time. But without automated clinical decision support, we're basically forced to rely on human memory, manual review, and just constant, exhausting vigilance to manage medications. And let's be real, modern medicine contains way too much data for human memory alone. Here's exactly how our manual system breaks down. Step 1, a rushed physician scribbles an illegible handwritten prescription. Step 2, the pharmacist or the nurse squints, having a really hard time reading the script. Step 3, the wrong drug, or the wrong dose entirely, is dispensed and administered to a vulnerable patient. It literally happens just like that. Paper medication systems are shockingly vulnerable to these completely preventable errors, just because we're relying on rushed handwriting instead of clear digital entry. And this leads directly to the nightmare of hidden allergy warnings. This is where missing data causes direct, immediate harm to our patients. If a patient's drug allergy history is unavailable, say it's buried inside some prior admission chart that got misplaced, that patient can receive a medication they are severely allergic to. This is not an administrative oops, it's a critical, life-threatening safety failure. And it happens because paper systems just can't pop up and give you an automated allergy warning.
Now for part 3, dangerous clinical blind spots.
You know, many diseases require us to analyze trends, not just isolated numbers. We have to look at kidney function in month 1, hemoglobin in month 3, blood pressure in month 6. We're supposed to track these vital health trends over long periods to properly manage chronic conditions. But actually reviewing these long-term trends using paper records, it's a labor-intensive, near-impossible task. Flipping through hundreds of disorganized, handwritten pages across multiple different visits makes serial tracking practically impossible.
And these blind spots cause devastating adverse events. Imagine a patient coming into the ER with chest pain. As the attending, I might not see their previous abnormal cardiac stress test because that crucial result is physically stored in an older cardiology file in a completely different wing of the hospital. Because of that missing cardiac data, I underestimate their condition and their diagnosis is dangerously delayed. Missing data leads to horrifying real-world scenarios. We see medications given despite known allergies. We see a physician unknowingly perform an invasive procedure on a patient without realizing they're already on anticoagulants. Vital documentation from other doctors goes entirely unseen, our communication completely breaks down, and critical treatments get delayed.
Move into Part 4, the chronic care struggle.
Look, healthcare is not a single visit. It is a continuous journey. But managing preventive medicine and long-term care is just an impossible task when you have to rely solely on human memory instead of automated system reminders. Paper records create entirely fragmented care, where we struggle immensely to just see the patient's whole story. Take routine diabetic care, for example. It requires constant tracking of several vital metrics: HbA1c monitoring, foot exams, kidney monitoring, retinal screening. Without automated alerts in the system, keeping track of these routine screenings across thousands of patients falls strictly on manual, human review. And in a busy clinic, things absolutely fall through the cracks. A diabetic patient might go years missing vital checkups simply because no one had an alert pop up to tell them an eye exam was overdue.
The tragic real-world consequence of this failure? Vision loss discovered way too late. Because of our failure to track routine screenings like eye exams for diabetic patients, diabetic retinopathy is often only caught after irreversible vision loss has already begun. These are entirely missed opportunities for prevention that permanently alter a patient's quality of life. Honestly, it's a devastating price to pay for a filing error.
Let's talk about Part 5, financial and physical risks.
I want to address hospital leadership directly right now regarding our liabilities. Because beyond the clinical harm, we urgently need to address the massive financial drain caused by these inefficiencies. We are facing a much higher cost per case. Think back to those missing lab results I mentioned earlier. When we can't find prior results, what do? We repeat the tests. Blood tests are duplicated, expensive imaging is reordered, not because we want redundancy, but because the piece of paper is simply gone. This leads directly to a massive financial burden of repeated tests, wasted hospital resources, and unnecessarily prolonged hospital stays. We are literally paying a premium for our own inefficiency.
And beyond the finances, there's the terrifying physical risk of permanent data loss. Physical archives are incredibly vulnerable. All it takes is one burst pipe in the basement, one small fire, or even just the daily wear and tear of a folder being passed around for a decade, and that irreplaceable patient medical history is permanently destroyed. Fire or water damage doesn't just inconvenience us, it permanently compromises crucial health data that can never, ever be recovered.
Finally, Part 6, the complete patient story.
Modern medicine has become highly complex, it's data-driven, and it's interconnected. Healthcare today demands way more than just scribbling things down on a clipboard. It demands timely access, integrated clinical intelligence, and proactive care. We absolutely must transition away from the fragmented, physical chaos of hunting down paper charts across multiple hospital wings. Instead, we need the life-saving clarity of a smooth digital search process, one that provides a complete, digital longitudinal story of the patient. In healthcare, information isn't just paperwork, it's the treatment itself. It's safety. Having the full story right at our fingertips is what allows us to save lives.
I want to leave you all with a provocative question to close out this explainer. Can we truly deliver modern, high-quality care while depending on a system designed for a totally different era? Because every single day we wait to modernize, we risk another missing allergy warning, another duplicated test, another lost file, and another patient harmed by missing information. The time to solve this clinical workflow failure isn't next year, it's right now. Thank you for joining me for this explainer. I really hope this provides the clarity we need to drive real change in our hospitals.